Critical care RN exams is one of the board exams that require critical thinking. The questions are intimidating, but it's the way you can approach them. Adapting class is here to help you. Welcome to the channel. In this video, I'm answering questions on cardiology, showing you key ways to answer them, buzzwords we can find in the case, simplifies the question in the easy way, and you'll be able to find the answer so easily. So sit around, let's practice some questions. I'll go and discuss the content associated with each question, the rationale, and you will never forget by watching this video. Question is going to look very, very long, intimidating. Forget about it. Adapting class, got you. Go for the buzzword. How do you answer the question? Read it from the back and figure out what the question is asking you. Which of the following intervention is the most appropriate initial treatment? Whenever you see most and initial, those are your buzzword. That means what? All of those are all appropriate, but not the most appropriate or the initial treatment you should provide. Now, those are the things I need to pay attention to. Let's go to the question. Figure out what the question is asking you. I pick most appropriate and initial, but you got to make a diagnosis in your exams, in your board. Every question requires diagnosis, then treatment. How do you figure out? Look at the stem of the question. A patient in the ICU developed acute pulmonary edema. They've given you the diagnosis. Acute pulmonary edema, number one, keyword. And what? And hypotension. If I see this, I'm going to look at the signs and symptoms should satisfy pulmonary edema and hypotension. What is that? Blood pressure, 78/52. Very narrow and pulse pressure, right? Heart rate of what? 118. Secondary to the hypotension. Respiratory rate too high, 32, with the pink fruity sputum. This is consistent with what? Pulmonary edema is satisfying all the information they've given you. Those are all buzzwords. Now, pulmonary artery catheter. This is a Swan gas catheter. What is it showing you? This is your clue. Pulmonary artery occlusion pressure, which is the wedge, which indicate left atrial pressure. That filling pressure is too high. That means something is backing up into the left atrium, probably from the left ventricle. The CVP is slightly high. It's telling me there may be something still backing up, right? But it's almost normal, so I'm not worried about it. 10 is in the normal range. Something is still backing up. Your systemic vascular resistance is 900 due to the what? Hypotension. All these findings is telling you something. And your cardiac output is what? 2.8. That means low outflow from the ventricle. So I have low outflow from the ventricle. Filling pressure in the left atrium is high, is backing up into the lung, and I'm having acute pulmonary edema. My CVP is still in the normal range, but I can tell that my blood pressure is too low, that my systemic vascular resistance is high. The key way to answer this kind of question is to figure out the underlying problem. The pulmonary edema is not the problem. The hypotension, the pulmonary edema, and the systemic vascular resistance increasing is due to low cardiac output, as you have seen. This may be the patient is in what? Severe cardiogenic shock. That's all. So we have a cardiogenic shock patient. How do you manage cardiogenic shock? Improve cardiac output. Give them ionotrope. Give them something that may help. So this is the key way to answer the question, and then you'll be able to answer it in the very, very easy way. I need to improve cardiac outflow. So what are you going to use? Fluid. Fluid with the wedge pressure that high and the CVP that is slightly elevated? No. If you give them too much fluid, condition is going to worsen. What is another clue in the question? Bolus. You can use fluid in cardiogenic shock, but it has to be limited. You don't bolus it. It's a slow flow. Therefore, the word bolus, let me take it away. Look at the furosemide. Usually helpful in pulmonary edema, but not when hypotension and low cardiac output are present. You don't use it. It may further reduces your preload and your cardiac output. How about dopamine? Well, somebody will say it's an ionotrope. Well, at this dose, 10 microgram per kilo per minute, has predominantly vasoconstriction and effect, and then beta effect. That means your heart rate is going to increase. Our patient heart rate is already 118. If you increase your heart rate too much, your cardiac output decreases. Therefore, which one is the right answer? Norepinephrine is going to improve. It's the first line. It's a vasopressin. You need a vasopressin. In the cardiogenic shock with hypotension, vasopressin is the best way. Cardiogenic shock with hypotension, norepinephrine is number one vasopressin you should use. It will support the blood vessels and perfusion with significant worsening of afterload and then improving your overall support. It's going to help with the blood pressure and it significantly improve the condition. But if you choose anything else, you can see that this question is a lot, but there's straightforward information that you can use. Make a diagnosis, connect the dot, look at each answer choice, and figure out if you're going to worsen the condition or not. And pay attention to the buzzword, most or initial. And that is what the question is asking you. Old male with the history of anterior myocardial infarction. Patient has a what? MI, right? That means he has a heart attack, right? Boom. He's admitted to the ICU with the complaint of what? Same story. You see, dyspnea. When your heart is failing, your lung is in trouble. He has chest discomfort. His blood pressure is what? This hypotension, low heart flow problem. Heart rate 180 due to the hypotension, right? Respiratory rate of 26, saturation is going down on 2 liters due to the backward flow. Probably the wedge pressure is going up. Bedside echo reveal what? Left ventricular dysfunction. They've given you away that this patient left ejection fraction is worsening to 25%. That means you have bad MI. Now we have what? Compromising severe left ventricular failure. Is going to present like the first case, the same thing. Which of the following hemodynamic profile will most likely be observed, and what is the priority intervention? As you can see, it's the same question you had, but critical thinking is presented to you in the different way. This is the same thing. The patient is in cardiogenic shock with the severe left heart failure, right? Left ventricular function failure. What do you think? What do you think? What do you think is going to happen? First, things is going to back up, right? First, also think about it. You need priority function. You need to improve cardiac output. The only thing here that improves cardiac output, butyramine is the only one. Contractility, ionotrope. Fluid is going to worsen the bad left-sided failure, right? Initiate nitroprusside is going to venodilate and decrease the blood pressure more, right? Initiate norepinephrine in this situation is not going to help that much because we have a better ionotrope. We have a better ionotrope here, right? The idea here is very, very important that you pay attention. We have a better ionotrope. This is not dopamine anymore. We have butyramine is much better. Now, what are you going to do? What do you expect? Look at it. First of all, let me go to the wedge pressure. The wedge pressure is supposed to be high. This wedge pressure is normal. I eliminated. Therefore, these three is high, right? And no, because of the hypotension, the SVR, systemic vascular resistance, is supposed to go up. This one is not decreasing, and this is increase, but this one is increase. Because this is normal, number 4 is gone. Because this is decrease, number 2 is gone. Now I have SVR both increase. My cardiac index, right, is supposed to decrease because of pure and poor cardiac output. So 1 and 3 are still there, right? My CVP is going to increase because blood is going to back up. So this and that is good. But what do I have? Would I pick dobutamine or nitroprusside? I'm going to put nitroprusside. So 1 is the better answer. This is how you answer these questions. They are long, they are intimidating, but take your time, figure out the buzzword, put them together, know the condition, make a diagnosis, and treat the patient. Thank you for watching, and subscribe to Adapt and Plus for more content like that. Good luck in your exams. Bye.